Australia hit with the deadliest flu epidemic in 25 years, as vaccinations against the killer virus run out. A research paper has concluded that last year's flu season was the deadliest in a quarter of a century for both Australia and New Zealand. The research paper was published in the New England Journal of Medicine and was co-authored by Professor David Pilcher from the Monash University in Melbourne. Professor Pilcher also works at the Alfred Hospital in Melbourne and told the Sydney Morning Herald that it was one of the worst weeks of his professional life. He said the intensive care unit was flooded with patients suffering from the flu, many of them not aware how dangerous it can be. In our intensive care unit, there were 30 ventilated patients, 17 patients that needed dialysis and 8 patients on artificial hearts, which is a huge amount of really sick people, he said. Flu records do not take into account the Spanish flu pandemic which broke out at the end of the First World War, which infected 500 million people globally and killed 50 million of them, more than the death toll of the First World War. Flu records only go back 25 years and according to research figures last year's flu patient numbers were the worst since 1993. Professor Pilcher said the worst cases tended to be when patients developed sepsis or pneumonia after catching the flu. Those complications took the lives of 800 people across the two countries with the average age of deceased patients being 70. However, a number of young people were also lost to the sickness. The next phase of the research will be to see if the spike in patient numbers also lead to a rise in patient deaths in the intensive care units as a result of extra strain on the system. Meanwhile, in Queensland, parents are having trouble finding flu vaccinations for their children on the back of a national shortage, the Courier Mail reported. A number of pharmacies are stuck waiting for new orders of the vaccine to come in, which is known to take up to 6 weeks. One mother reportedly told the Courier Mail she visited 6 different pharmacies trying to get her young son vaccinated. People 5 years and younger of 65 years and older are safe at this stage with the number supplies still available under the National Immunization Program. The major issues are finding enough reserves for those between 5 years and 65 years old. Pharmacy Guild of Australia spokesman Greg Turnbull admitted that supply numbers nationally was a problem. The stocks are ordered before the season on best estimates of demand, and because there was a bad season last year and a lot of publicity this year, the demand has been higher than expected, he said. Queensland's Chief Health Officer Jeanette Young told the Courier that the federal government has enough flu vaccines stockpiled to supply the National Immunization Program. Ms. Young said the government had already issued 47% more influenza vaccine than at the same time in 2017, while another government spokesperson said an extra 950,000 flu doses had been secured. All of these vaccines are expected to be available ahead of the anticipated peak period of seasonal influenza transmission, which is usually August or September, the spokesperson said. Figures from the Australian Medical Association of Queensland have also shown that 4,500 Queensland residents have already been diagnosed with the flu this year, an average of 80 to 100 per week. Australian Medical Association of Queensland President Dr. Dilip Tupilia said the rise in demand has had an obvious effect on flu vaccine stocks. I guess those increased efforts have provided some shortages in areas, especially in the private sector, but it's never too late to get the flu jab, and more supply should be here in the next 4 to 6 weeks, he said.